And welcome back. Sapna NYC is a not-for-profit organization that's transforming the lives of South Asian immigrant women by improving health as well as expanding economic opportunities, creating social networks, and building a collective voice for change. And here now to share more, we are pleased to have the executive director of Sapna NYC, Diya Basu-Sen. And we thank you, Diya, for being with us.
Excellent. Thank you so much for having me today. I look forward to our conversation.
It is. I'm looking forward to the conversation too. Talk to me a little bit about the organization itself, Sapna NYC, and as we talk about the work that you do, really catering to empowerment as well as advocacy.
Absolutely. So Sapna NYC, as you mentioned, works with South Asian immigrants, mainly through the women in the families as well as children. And our focus is really in building community power, building strong immigrant support. A lot of our families come and they don't necessarily understand systems in the US. They don't have networks. They don't have people to ask questions. And so we kind of serve as that point of entry for families. Our services are really holistic. So we believe that physical health, mental health, and women's empowerment are all linked together. And so women who come to our center can receive domestic violence support, they can receive mental health counseling, English classes, food assistance, and more, all in the same place.
And when we talk about the women that come through your doors, obviously a lot of needs. COVID has definitely ramped up needs for everyone. Talk about what are some of the basic needs that you're seeing many of your clients need.
Sure, absolutely. I think really COVID has changed our work a little bit, or I would really say expanded our work. So when the COVID crisis hit, our families are working class immigrant families. So there's some of the people that were hardest hit by the pandemic. We were seeing a lot of food insecurity, housing insecurity, a rise in domestic violence. So we started work in some of those areas that we traditionally haven't done as much work with, particularly with food insecurity. So in May of 2020, we started a food pantry. Over the course of the pandemic, we've distributed about 200,000 pounds of food, really focusing on culturally competent foods that they're often not able to get in a regular food pantry. And then in the East Bronx, we're pretty resource poor, so there just wasn't enough capacity in the pantries that did exist. We also connected families to over 150,000 in financial assistance. Some of it was rental assistance, some of it was from the Excluded Workers Fund from the state. Some of it was just micro grants from different private organizations. But we recognized that our family needed immediate financial and food assistance, and we grew those two areas of our work. But at the same time, we also saw that, as kind of, I'm sure you've seen as well, the mental impacts of the pandemic have been huge on our communities, on everyone really. But particularly in these communities where they've seen such high losses from COVID, they've had to deal with, again, fear of eviction, fear of not putting enough food on the table for their families. And so we started a mental health initiative last year. We were able for the first time to hire a mental health counselor that speaks Bengali and Hindi and is able to do both clinical counseling sessions, but also to approach mental health from a more traditional way that's rooted in our culture. So we run women's circles and domestic violence survivor circles, special needs circles, because we recognize, again, in our community, there's a lot of stigma around accessing mental health. And people aren't really used to using a service unless they have maybe a diagnosed mental health condition.
Yeah. So as we look right now, I know that some of the services that you talk about in regards to empowerment, advocacy, those things are prevalent. But I want to also talk about one other area, which is citizenship, because when we talk about citizenship, pretty huge. But we talked a little bit about COVID just a few seconds ago, and knowing that the COVID-19 pandemic has kind of like halted a lot of citizenship, put people on the back burner, if you will. How is it going by way of citizenship? And talk about some of the services that you provide in helping people in that area.
Absolutely. So for us, civic engagement is really important in building that community power and allowing our community members to be involved in the political process and to understand kind of what their rights are and also how they can be involved. So For us, it starts with just citizenship classes. And in those classes, we help women so that they're actually able to pass the citizenship test. It can be daunting, right? Even if you are born and raised here, there's so many questions that maybe you don't even know the answers to. But as immigrants, they're learning it in another language. So the classes help them actually understand what the questions are, understand what the day of will look like for the test so that they're not as nervous, and just kind of prep them for that. Once they finish, we also register them for vote and to vote, and we explain kind of the process of what the different positions are in our political system, what kind of some of the local elections are, so that they can actually be active citizens as well.
Yeah. And when you come as into a community, sometimes it's hard to learn the community, learn the culture. And I know that that's your job to help to bridge the gap and also to be able to meet the needs of those persons that come. Give me a little bit of insight when you're dealing with your community and dealing with those constituents about their knowledge of rights, their knowledge of what's available to them, resources. Are we finding that people know a lot, or are they pretty much a novice when it comes to knowing about the resources and the rights that they have?
So we find that a lot of people actually don't know what their rights are, particularly for us, one of the areas that we do try and educate our community on is workers' rights, right? A lot of our community are doing kind of lower level positions, which leave them kind of open to exploitation. They're jobs where there aren't a lot of benefits, and they, again, easily can be exploited if they don't know what their rights are and to ask for them and how to advocate for them. So we do talk to them about workers' rights. We also, around elections, talk about voting rights too. So being immigrants and, again, English not being their first language, what are their rights to language assistance? What are their rights if they have a disability and they need help? Some of those things. And then we also just have conversations about, what are the actual positions that you're voting for, or what are the ballot measures and what does it mean? Last election, we also did a lot of work around ranked choice voting because that was something completely new as well.
Yeah, education and the voting process could be, I mean, even for those of us who are familiar with voting, when it came to ranked choice voting, I think a lot of New Yorkers really struggle with just being able to navigate and bridge that gap. And so, what's it like for you in terms of community? When we say community, I mean support from leaders, officials, and really galvanizing around your community in terms of meeting needs, in terms of making it happen. What's it been like for you?
Sure. So that's always an ongoing process, with the elected officials, and I think we just saw a lot of turnover, right, in the city council this past year. So we're really excited about kind of the new people we have, and we've already started working with them on kind of different projects, and I think we've gotten we've had good reception from them to ideas and to trying to work for our communities. So we do try and engage with elected officials, whether it's city council, state assembly, state senators, to kind of not only offer our services because we want to serve as a referral for any families that come to them, but also to kind of bring awareness of the issues that our community is facing, because unless you have those conversations, they may not be aware of some of the specific needs that our community has.
Yeah. Health, a big issue in our borough. We know that in the borough of the Bronx, of course, 62 out of 62 when it comes to how we rank, but we're always looking at ways of improving health. I can talk from the perspective of doing this for a long time and knowing that sometimes access to resources when it comes to health aren't always prevalent in our community. Talk to us about your path of dealing with the health disparity that's going on right now.
Absolutely. So our work in health kind of covers a lot of different areas. And generally what we think about when we design health programs is there a program that exists? And if so, kind of what are the issues in terms of access? And maybe it means that there is a program and there's just not enough information and we need to help with that kind of connection. Or maybe it means the actual program itself just isn't appropriate for our community. So kind of to give you an example, with COVID vaccines, right, the services were there, but our community wasn't always receiving the messages. The language skills weren't really there necessarily to have people answer questions about, safety, or, can I mix boosters, or things like that. And also, right, a lot of times doctors don't necessarily take the time to actually have those conversations with patients. So in that case, what we helped with is, again, how doing outreach about the vaccines themselves, what is, safe for your families, who's eligible, at which point in the pandemic, and also actually making appointments for people because that digital literacy also was missing. We also had vaccine events where people could actually come to our offices and get vaccinated on site as well. So in that case, it really was just a matter of connecting them to those resources. In other cases, maybe those resources don't actually even exist for our community. So a couple of years ago, we started a diabetes prevention program. And that was something where we felt that the mainstream programs just really missed our community completely. One, again, because of that language piece, but also because the recommendations they were making were all based on American culture and tradition. So they didn't know what questions to ask sometimes when it came to diet. The recipes or suggestions they made had kind of no relation to what our families normally eat at home. And then also certain kind of things around exercise culturally. Um, some of those things just weren't as well received by our community or as accessible for our community in terms of going to a gym or things like that. So we created a fitness program that we actually delivered in our sessions, where women were able to have ideas of ways to exercise that actually didn't require them to have a membership or to purchase any equipment. We delivered uh, a DPP program that actually taught them about their own diet and how to amend it, and did individual conversations about, where are the gaps and where can we make those adjustments. And we saw really great results with a lot of A1C scores dropping, a lot of weight loss as well. And so that's something that we're hoping to bring back as well now that kind of we're emerging from this pandemic.
Great work there. Talk to me about your work with the Bangladesh community, because I know a lot of your population comes from Bangladesh. Can you give us some insight into the Bangladesh community that maybe we're not so familiar with?
Sure, absolutely. So I think in Parkchester, we have a really large Bangladeshi community, but we also work with families throughout the boroughs as well. And a lot of the needs we're seeing are, again, around language. So we deliver English classes. Digital literacy is actually a huge need. We have a lot of people who are interested in developing their computer skills. It's actually something that was born out of a community meeting we had where women were saying that, in order to get jobs, in order to better help my children at school, I really need to have computer skills. And I think it's something that we also have seen in this pandemic, that that digital divide really meant a huge difference between people getting services and having access to benefits and not. So we started a computer literacy program, and we teach 4 levels of computer classes, starting from, this is how you turn on a computer, this is how you hold a mouse, going all the way to Microsoft Excel. And again, that's to help with people wanting to work, but also just kind of for daily needs like internet searches or being able to apply for benefits. And then the other piece, again, that I mentioned earlier is the mental health. In addition to that physical health need, I think unless we address the mental health needs of our community that really existed prior to the pandemic, but were exacerbated by the pandemic, I think it's really hard for communities to be strong and healthy.
You do a great job of galvanizing the community and putting them together. I know you've got these action groups. Share with us about how you get community, because we talk about promoting civic engagement, a portion of our show. You do a great job of really promoting civic engagement amongst those. So how do you get your action groups going, and how do you get them out there for the causes?
Sure. So, as a community based organization, we're committed to actually hiring people from within the community, and also making sure we engage with the community and have our women centered in the work. So our community health workers or frontline staff are all from the community, but we also use these action groups, as you mentioned, when we have particular projects. And they could be health programs, they could be civic engagement. It's not necessarily only for civic engagement, but in these programs, we actually train groups of women on whatever issue area we're talking about. And we also train them on how to do effective outreach and leadership. And then they kind of go out into the community and serve as ambassadors for that cause. And they help us really reach some of those pockets of the community that we just don't have entry into. So to give you an example, with this 2020 census, we had an action group of about 10 women. And with those women, we were able to help around 800 families actually complete the census. And we did outreach to about 4,000 families.
Big numbers there in terms of reaching out to people, because sometimes when we look out there, you see that the people just don't know, and
Yeah.
reaching out makes a difference, and being able to connect. I want to talk about your connection, because I know that some of the work that you do actually, it transcends on a local level, but then it also transcends on a national level, right? Going to Washington D.C. And being able to lobby, and to be able to speak to particular issues. You educate your group on how to be able to do that. What's that been like for them to have the experience of knowing, listen, we can talk about this on a local level, but then we could also have our voices heard on a national level to try to possibly even create change?
Yeah, so I think for us, we're really committed to raising the voices of our community and also trying to empower them to use their own voices as well. So we do have them sometimes join us in meetings with elected officials. And if they are not able to join, to make sure that we're bringing these issues that we're seeing on the ground to the people who are in office. And so we work in coalition with other groups. And one of the big things that we're fighting for is budget equity, because we see that in New York City, particularly, right, the Asian population is growing. We're almost 18% right now. But in terms of how much funding our organizations get, it's just nowhere close. And so a lot of our work is just for budget equity on a city level, on a state level, on a national level, to make sure that in coalition with these other organizations that we're lifting up our communities and making sure they're getting their fair share.
Yeah. Diya Basu-Sen, we got to leave it there, but thank you so much for joining us. I think a great conversation, giving us some insight into the work of Sapna. She's the executive director of Sapna NYC. And if people want more information, what do they do?
Sure, we're happy to have you all reach out to us if you want to volunteer, if you need any services. The best way is to email us, info@sapnanyc.org, or to give us a call, 718-828-9772. But you can also look at our website, it's sapnanyc.org, for a lot of information on some of the programs that I didn't mention today, and as well to get in touch with us. Thank you so much
Diya,
for having me.
Diya, thank you so much. And I want to let you know, we want you to stay with us here on the show. We've got more coming up. We're going to take a quick break on the social justice forums. We'll return right after this.